My name is Jamie Marra. I'm a fourth-year dental student at University of Otago, and I have a question for you. What do you do when you have a sore tooth? If you live in Dunedin, you could book an appointment at a private dental clinic or the dental school. But what if you live in a new country? You speak and read in a different language. You don't own a car. Maybe you struggle to afford your family's basics like food and shelter. There are vulnerable subpopulations in Dunedin that face these realities every day. For example, we resettle former refugees under the United Nations Human Rights Council in communities across New Zealand, including Dunedin. My summer research goal is to find out what former refugees do when they have a sore tooth, or specifically to describe pathways former refugees take when seeking oral health care here in Dunedin. Evaluating healthcare pathways can sound abstract, but we are using a simple framework to triangulate where problems originate. Structure includes factors like site, staffing, and number of dental chairs. Process can be technical treatment sequencing or interpersonal like accurate and complete documentation. And finally, outcome, which is essentially a change in health status. Think of healthcare pathways like a ship's voyage. Structure would be like wood, steel, and other building materials, as well as equipment like lifeboats and human resources like crew. Process would be like a crew's navigational training and communication lines. Outcomes? Well, let's go with a familiar one. In the Titanic's maiden voyage, 97% of the first class, but less than 50% of the third class, survived the passage. The iceberg didn't cause mortality. Availability of lifeboats, a structure variable, the crew's navigation training, and poor communication, process variables, are what led to the outcome. We know vulnerable populations experience more stops on the pathway to care, but we also need to know what those stops are if we hope to improve resource utilization. Ultimately, research like ours seeks to inform healthy policy development so all New Zealanders can more readily access oral health services and have good oral health for life.